guys, Dr. Matt here, back in for another Wellness Wednesday. So continuing our series here on evaluating, fixing, and preventing. Last week we talked about the evaluation process here. We've gone through that thorough examination, that thorough history, and now we started to gather those pieces of the puzzle and have given us some direction about how we're going to go about taking care of you. So what would that fix-it portion look like here in our office? Well, there's a handful of tools that we utilize to help take care of you. The main one being these guys, our hands, and the knowledge that we gain through that examination. But we also have some other tools in the office as well. And I want to highlight some of those, especially the most common ones that you might see in use here at Venture. And I won't be going into in-depth detail about each one, but I just want to give you a little kind of flavor, taste of what you could experience. So one tool we might use here in the office is the activator. And this is really good for when we may have to go a little lighter, especially maybe with young children or an older adult where the bone structure integrity is a little bit more compromised. But the activator is really nice because it's very pinpoint with the direction of the force, and it's very fast. So we don't have to have a lot of force. We're relying more on the speed. So this can be a really great tool to start off gentle if we need to go that route before we go more aggressive. Now, another tool you'll commonly see is a factor tool. So I have another video that we posted where I talk more about factor and go a little more in depth with it. But main idea is working over the soft tissue that's injured and trying to help promote increased blood flow, increased oxygen to those soft tissues to help speed up that healing process. So factor is a common tool that you will see us use here at Venture. We may also utilize some dynamic tape depending on your injury, or if you're an athlete and you're looking to get back into the game. Dynamic tape can be really helpful to not necessarily help heal what's going on, but help prevent further injuries so that you can heal quicker in that. I also want to highlight some of the tables we have here at Venture because they do some unique things that really help us take care of you. One of the most common things is the drop piece on our tables. So where the table comes up, and now again, we get to utilize more speed versus force. So sections of this table will pop up and then drop down. It's a very useful tool. We can also go side to side as well to help work through that full range of motion of that low back. We also have a similar feature for the headrest that enables us to do the same kind of flexion distraction, but for the neck. And last but not least, corrective exercises will also be utilized to help get you active in your care and speed that healing process up. So next week, we're going to take a look at, once care is done, what are the next steps afterwards? Hope you guys have a great week. We'll see you next time.
Everybody's moving, everybody's moving, everybody's moving, 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 moving. Everybody's moving, everybody's moving, everybody's moving, 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 and stop.